All right, back with some more Q&As. Hopefully you saw the last video that I did and reviewing clients' blood work. So the female using the Retatrutide, SLU, BBC, and methylene blue, and the improvements on the blood work. We'll continue with the protocol and tweak some dosage and increase some physical activity and manage the uh, what we're doing before we go get blood work, like making sure that she's fully hydrated and also not having a high fat meal within like 2 days uh, before the blood work to help get us a better idea of really what's going on with the cholesterol. Highly improved, highly improved. So if you haven't watched that, just go ahead and watch that, and you'll get an idea of what I do. Um, so we do have a few different questions. One of them that just popped up again was the whole study about energy drinks causing cancer and its taurine causing blood cancer, leukemia. Again, these are on disease state uh, correlative findings. So you can't say, correlation equals causation. Maybe that person had leukemia and they're like, oh, what do you like? What's your lifestyle like? And they're like, maybe they're a video gamer and they drink a lot of energy drinks, or they're a bodybuilder, or they're a fitness enthusiast, or they're a mom. Uh, they're drinking energy drinks, but they're also not saying what else they're doing as well. Maybe they'd rather say energy drinks versus, yeah, I do a line of cocaine. So, or methamphetamines, or I do Adderall. Like, so your people again are not always honest, so you can't take correlation equals causation uh, to be truth. Now, someone did bring up the fact that there's like this medication to help with lowering blood pressure, and it's injectable and it's biannual, so two times a year, and it's known as Cardia 2, and there's 663 participants whose high blood pressure was not adequately managed with standard treatment. And so in the trial, the patients received an injection of a new medication called zilebesiran, and in addition to their usual medications. Now, this is in the UK, so typically UK, Middle East, they're all going to be the people that do these studies beforehand with these drugs because America is so slow and taking their time bringing it to the public while they are using these drugs with elitists in the United States. We, um, so pretty much the study, there's an abstract on it, which the abstract, I don't have access to this journal to, uh, yeah, I don't have the access to the JAMA journal. So, I'm not paying for this. But anyways, it doesn't tell you the previous conditions of these participants. So we don't know what they already had as far as disease state individuals. And if the blood pressure problem, um, are they overweight? What's their diet like? Do they even do any exercise or cardiovascular training? Do they do any weight training? Um, or do they have diabetes? Like nothing shows you in these abstracts, which again, they probably don't even take, like they don't even look into it. Um, they just say, oh, this person has renal failure or acute kidney disease, or this person just, again, is unable to regulate blood pressure, which is, again, they don't even say if these people have type 2 diabetes or type 1 diabetes or type 1.5 diabetes. They should be very, very clear on this, and they should even allow access to that information on the abstract. But I think they should also have, if you're a participant, I think you should have pictures, photographs of your full body, so we can see what type of person you are, what type of individual, so we can have a better understanding of who these people are being tried with this drug. So that's why I don't take into account these studies. So, for example, there's someone asked me about Retta and like said that it causes uh, and this was just brought up on another podcast too, a bodybuilding podcast. Um, they're saying like it speeds up aging of the skin. Well, that's not retatrutide. Let's not put the cart before the horse, right? We know this for a fact, or are we just saying it because people look older? Because a lot of people that are on GLP-1s like semaglutide, tirzepatide, these other generational drugs, they they undereat or they become malnourished or uh, tons of other reasonings, right? So if you're underfed, undernourished with collagen and copper and zinc and every amino acids, things that help to create collagen and also muscle and keeps that skin tone and and the youthfulness. So you're also probably not helping your body create growth hormone, maybe IGF, maybe you're not sleeping well. So there's all these different things that come into effect. To say that just because you're taking one drug and it makes you look worse, then we can do that with a lot of things. I mean, look at how many people take vitamin D, but they have very bad looking skin. So you're going to say vitamin D causes your skin to get extra wrinkles? No, it's probably these same people. They probably have other factors in their lifestyle that cause them to have this effect on their skin. Or there's a genetic variables, right? So let's face it, I'm gonna be a wrinkly old white man whenever I'm in my 50s, right? I'm getting there now. I see it. Whereas I have other friends of other ethnicities and they have way better skin. And then Mother Nature just catches up to us all, right? And then like they wake up the next day, the people had perfect skin when they're 60, and then they're 61, and then they look super wrinkly like a prune. So I would not blame retatrutide on making people's skin look worse. That's more of the lifestyle. Also, the other thing was, well, what if I get off of it? Am I going to binge or not be able to control my appetite? Dude, I'm suggesting 1 milligram every 7 days. I'm not this person that's suggesting to keep titrating up. Retatrutide, in my opinion, it's not meant to blunt hunger. It's not. It's not semaglutide. It has a very low amount of GLP-1 in there. It's meant to help you with transition away from your addictive behaviors and improve on those things. So if you're not trying to improve, if you didn't go into using retatrutide and said, "Hey, I have these problems. This is my accountability. I need to fix them, and this is how I'm going to fix them." But I'm also going to take retatrutide because it can block out food noise. It can help with get rid of or not get rid of. It can help manage addictive personalities to alcohol, cigarettes. I mean, I'm making these lifestyle changes. Once you have these lifestyle changes, set in stone and they're foundational for your everyday must do's, you're coming off of it, you're highly unlikely to rebound. There's non-negotiables in life. And this drug, retatrutide, and then I'm assuming the next drug is going to be even better at what it does because either they're putting in a myostatin inhibitor or IGF. I don't really care for those two. I think that's kind of again for preserving muscle, which we know people taking retatrutide, you're not losing muscle. I don't see it. Again, I'm not going up to 4 milligrams. Uh, 10, 12. I'm not going up that high because I do not want to mess with my gastric emptying. I want to help with refocusing my energy and thoughts to something productive and also to help balance out blood sugar. It is taking control of something in my life that I didn't have control before. And that's where this shines. Am I going to be on it forever? No, but I do think it takes time for it to build up. And if you're on a low dose, I I'm a firm believer that you're probably not going to have negative side effects if you are not a disease state individual. So if you are, then you're probably going to have repercussions, right? But if you are for a bodybuilder, for example, I think it's fine. 1 milligram every 7 days. Again, 1 milligram. We're talking so small and not titrating up. You're just improving blood markers for insulin sensitivity and reducing blood glucose. So you're becoming more insulin, or reducing insulin resistance. You're becoming more insulin sensitive, right? So you're going to help with with mitochondrial function in the body, increasing nutrition uptake. You're doing all the healthy things without having adverse effects. Now, there might be side effects, like maybe you get dizzy, right? Well, that's a side effect because your blood sugar's improving so well that you're becoming so insulin sensitive that now you need to actually maybe increase carbohydrate consumption throughout the day. You need to add some more calories because your brain, you're maybe you're more productive throughout your day, and your brain is what is the organ that uses the most glucose, right? It's not true that it prefers ketones. Like it's not. If you are on a ketogenic diet, a true ketogenic diet, 70% of your calories coming from fat, then your brain can adapt, right? It's like when they say cancer cells um, only get energy through glycolysis. Like that's not true. It can use energy from any source. It's so adaptive, which is why it's so hard or what seems near impossible to find a cure or a manageable drug for cancer cells. Cancer cells are very, very smart and they're very quick to adapt, super quick, which is why we have problems with controlling it in the world. Okay. Um, so the anyways, I think that kind of goes over that. But the same person that was asking me about the Retatrutide, they're also asking about like the possibility um, of your body of it like working with microplastics and causing your body to to be very dysfunctional. Again, this person also wears a CGM and they wear an Aura ring. Now, here's my question though. Like if you're so concerned about microplastics and all these things that negatively affect our body, the CGM is made of plastic, right? Like it's on your body. You're taking hot showers. So there's temperature fluctuations. You're in a hot environment, cold environment. There's all these things. Your body has microplastics. So you're putting a device on you to help you track your health. But yet you're probably putting microplastics on your body because it's like stuck on there, right? Like it is tegadermed on there. And then with all these wearable technology, fitness accessories, I mean, now you're concerned about 5G and was it EMF or something, whatever that's called. It, it doesn't make any sense to me. Like you can't say uh, taurine causes leukemia, like blood cancer, but yet you're wearing a microplastic device on your body to check your blood glucose. Well, your blood glucose, and then your CGM goes haywire whenever let's say you're taking a shower, you see a spike in blood glucose. You're like, man, I didn't even eat anything. Well, yeah, because that's an effect that happens sometimes when you take a hot shower, right? You see it in type 1 diabetics. It does like a cortisol response, right? And so that affects your blood glucose. So you see all these weird readings. And again, I'm glad that some podcasts are speaking out about it. And being in the medical field and having seen this for a very long time, um, and unfortunately, I was not smart enough to be able to put it on the internet sooner. But to see like-minded people be like, oh, hey, I saw that same thing. And it's interesting because now we have more evidence, and it's not clinical evidence from, you know, researchers, but it is anecdotal evidence from people's experience and tracking it and recording it and logging it on YouTube or Instagram for others to see. Um, I can't, Justin Harris, I think, was talking about it with, I can't remember the podcast, but this Paul guy that shows his CGM after having like a sugar-free Starbucks and such, and his blood sugar rises. And then with black coffee, it rises. I mean, there's so many different things that go into blood sugar spikes and troughs that it's not all food related. So if we stress ourselves out enough with thinking, like stress and cortisol, you'll see spikes in blood sugar. It just happens. I mean, there's times where people can get so scared that their blood sugar drops, right? Because it spikes and then it drops, and they haven't eaten anything, but it's just like because of the spike of cortisol to raise the blood sugar to push the sugar into your bloodstream from the liver, it'll cause that to happen, right? But it's not that you're hyper or hypo. It's just that event that acutely happened. So it's interesting to see. Um, but I think as we continue to go down this route of GLP-1s and people trying to improve longevity and reduce microplastics, you're going to see a lot of things happening within the gut. You're going to see a lot more natural aids to go along with pharmacokinetics. So like natural GLP-1s or things that enhance GLP-1s or manage um, like uh, ATP production and such. I think you're going to see more of that work together and not separately because there's a lot of people that are talking about not like you don't need prescription grade GLP-1s. I think I had the idea that they were terrible. I was like, okay, they're going to cause pancreatic cancer. Like this is not good, right? It's going to cause malnourishment and a lot of other issues, bone disease, more fractured bones. Great for orthopedics, right? You have all day resetting bones and whatnot, replacing joints. So big money maker, right? That's not the agenda. I just think that you can't say that um, that this person does not need a GLP-1 prescribed to them just because I don't need it, right? That's that's like saying, dude, I had surgery. I didn't take any pain medication that they prescribed me. Why? Because I don't like pain medication. But if I needed it, I will get something. I'll get like a Toradol IV or something, right? But or if I need it, right? But I didn't go and seek an alternative of like white willow bark to manage my pain because it's not the same. So you can't say that this person doesn't need GLP-1s whenever his problem is an addictive behavior. There's not a natural food out there. Like food is a trigger, right? Okay, so let's use food. You can't say, oh, eat this food to help with the addictive behavior of binging and purging, right? If that person starts eating the food, it's going to start that habit. So what's better and what's healthier is this drug at a very low dose, so retatrutide 1 milligram, and reduce the food noise. So now they can eat things without triggering them to have a binge and purge episode. So you can't, again, you can't be like, oh, well, fiber and protein, they're all natural GLP-1s. It doesn't work like that, man, because it's going to trigger them with their state of illness. And so we have to treat the illness first. Okay. Like it doesn't make any sense to me when you're fighting on this. Can they work together? Yes, they can work together, which is what it's always been. But for some reason, there's a division amongst natural uh, advocates and then people who have who use pharmacokinetics. They're not, they shouldn't be separate because you're going to need one or the other at some point in time. You're going to need some overlap. And that's where moderation comes in. Okay. So there is the theme of moderation that you hear me talk about. And it takes a long time to get there. From my experience, it took me a long time going from such extreme sides, and I still do extreme things, but I also have moderation and I track my blood work and again, if I'm doing something extreme, I know I'm putting myself at risk. So I know the dangers of it. So there's another podcast that says like the guy was talking about like the dangers of like bodybuilders put themselves through with anabolics. Well, they're like, well, rock climbers that free climb or free scale or whatever it's called, they put themselves in a situation where they slip, they die, right? So there's different dangers, but there are precautions that we can take. there's ways to have a safety net. And so, moderation in things, blood work, having a healthy diet with, again, specific types of food that is meant for your body, that makes you feel good and perform good, then that's our safety net. Okay. Um, so I had one guy that asked in my DMs, he's like asking me what time of day do I prefer to inject my testosterone. Um, I prefer to inject mine whenever I remember with because I do it every other day. So if I'm ready to inject and I have time at night after a shower, I'll do it, or in the morning. I just think that it's better uh, to have less blood flow in the area where I'm injecting. 'Cause, typically will bleed a lot more, so I can have a risk of a bruise afterwards. There's no pain or anything, but it just does have a slight bit of bruising whenever I have too much blood flow. So like post workout, I'm not a big fan of. I, and again, we're using 27 gauge needles, and they're like 3/4 of an inch. No, less than that, half an inch. I think they're half an inch. I don't have a lot of body fat on me, um, so it's really I would just avoid nighttime if you're taking something that keeps you awake. I'm not a fan of fast acting esters, but in the morning would be the most ideal time, especially when people are using more harsh compounds like 19 ors. That sometimes that can cause a little bit more neurostimulation. So you wouldn't want to take it at night before going to bed. It's kind of the same idea like with B vitamins, right? Some people are super sensitive to them, even if they're not deficient. If you're deficient, you are going to be very sensitive to B12. So you wouldn't want to take it at night before going to bed. Same thing with vitamin D. Vitamin D, if you're low, you can have a very awakening response to taking vitamin D. So I would take vitamin D with your first meal of the day. Or if you're taking fish oil in the morning, take it with your fish oil in the morning. That's enough fat to get it to where it needs to go. Um, B vitamins, kind of the same idea. If it's not already in your multivitamin, like methylated B vitamins, or you can split the dose of the B complex, methylation B complex vitamin. Have your multivitamin in the morning with it, and then you can have a separate one with maybe your post-workout meal or something. Well, so it's not going to keep you awake. So it really, my time of day, for me, it doesn't really matter. I just want the least blood flow as possible. I want my muscles to be uh, a little bit more pliable. So I don't want to stick it into scar tissue or a muscle that's very tight. Then I'm at risk for more swelling in that area, more blood flow. So I'd rather uh, inject with less blood flow in the morning seems to be good, and then massage it afterwards. Um, this guy had a GH question. So he was asking me about like growth hormone, um, and like the whole again, this goes back to the cancer thing. It's like a longevity thing. But there's no evidence that growth hormone causes cancer, nor does it cause cancer to grow faster, from my opinion. And this is my opinion based on reading trials, but then also being observative and looking at anecdotal evidence, right? So again, clinical trials don't really mean too much to me. It's usually done on rats or disease state individuals. So I don't take a lot into what they say. Now, you would see a lot more kids who are on growth hormone who are prescribed it. They would have cancer growing up. We don't have data on that. AIDS patients, you would see them be riddled with cancer. We don't have data on that. Bodybuilders, tons of bodybuilders should have should have tumors. We don't have a lot. Usually, if they have any type of like liver tumors or other tumors, it's because of something else that they had dormant, and then it just increased the growth of them because they've already had it, because of the spike maybe in the conversion of IGF. But Here's the other kicker. Are they taking just growth or are they also taking growth fragments? So are they taking IGF-1 fragments? Probably they are. I would bet my house on it, right? You're taking other things. You're probably taking recreational drugs too. So there's a lot of people that had liver cancer and the amounts of other drugs that they were doing, plus the training and the stress in the life. I mean, you're going to hurt yourself. It's not just the growth hormone, nor is it just the anabolic speeding up the cellular proliferation. It's not all that. There's so many variables you have to take into account. You cannot say correlation equals causation. Again, we don't know what people do behind closed doors. Okay. Um, Last one. This person was asking about Clomid while on TRT. I'm not a big fan of Clomid. For me, it just causes a lot of emotional issues, like where you're crying and watching movies like Good Dinosaur, or you're crying watching, you know, Chicago Med and someone dies, and you know, I don't want to have that feeling. But I would say if you're taking it to try to increase like sperm load, then I would say have at it. You know, it's fun. Do that plus HCG, let your balls grow bigger, and then all HCG also increases load production. Clomid does to an extent, but not as much as HCG. So like if your partner is into that, then take it. But if you're trying to look for estrogen management, I would just go with a regular Adex or Remicin, or if you want to do another injectable, Primobolan, uh, Masteron seems to really help reduce estrogenic side effects without dropping estrogen, so you still get the IGF-1 response and growth. Plus, it's cheaper than Primo, and to me, it works better because you can dose it lower. Primo, I feel like you have to dose a little bit higher. Um, yeah. Um, Let me just go to answer this one. This person is asking about like DHEA um, and taking an AI. You don't need to do that, man. If you're taking DHEA, why would you take a prescription aromatase inhibitor? You're going to just destroy your estrogen. You're going to lower it so much. DHEA, you take it, you can take DHEA or you can take pregnenolone. Either one of those, pregnenolone probably might be a better idea, but it helps your body to naturally create its own hormones. But the problem is, unless you are in perfect health, your body won't really know how much of testosterone, estrogen, and progesterone to create, uh, because again, you're not in good health, so you don't have mitochondrial uh, optimization. So because you're not optimized, you have low DHA and you're trying to use it to increase testosterone. Your body's not going to just increase it beyond your normal ability to make what it makes, right? It uses cholesterol as well, and it uses the mitochondria to create hormones. So it'd be pointless to use it to try to increase your testosterone, even high enough to use a prescription grade aromatase inhibitor. Don't ever do that. Like you don't even need Letro if you're taking TRT or HRT injections. Even if you're taking 300 milligrams of test a week, you don't need Letro. I'm sorry. But you could take DHEA and DIM, right? I think that might be fine. Um, or Aremistane, and that might be fine. I know like Blackstone Labs still sells it. I think it's called Eradicate. High Tech Pharmaceutical sells it. I don't know what it's called, but they sell it. But yeah, DHEA, go ahead. Have all day at it. It might improve joints, but like pregnenolone, I mean, I would say that would help like with joints, with skin, with cognitive function. So you might be better off with pregnenolone and start low, start like 10 milligrams and kind of dose it up 10, 20, then 50, and then maybe 75 or 70, and then 100, and kind of go from there. And then just have the AI, over the counter AI, it's not the AI, the over the counter estrogen management supplement on hand, just in case. All right, that's it for today, and I will see you guys whenever I decide to see you again. Like, share, comment, subscribe if you got this far, and yeah.